But you know what, Shirley, is to me so interesting is how often you'll see such simple remedies. I have seen people been given viral antibiotics for chronic canker sores. You talk about shooting a gnat with a cannon.
That is.
I mean, you know,
wow.
and if it's way out of control, I mean, we know when that time is.
Yeah, well,
you know, we know. Well, sure, we also got an email from Blanche in Mississippi. She writes, I have nasal and food allergies. I have been taking Zyrtec, which is similar to Benadryl, but kind of like...
Or like Claritin and some of the others,
strength. I've been taking Zyrtec daily for years, and it works very well. Is there any harmful effects taking this type of medication over a long period of time? We want to direct that question to our resident doc, Dr. Walt Larimore.
Well, allergies tend to come from a reaction in the body where substances outside the body, we call them allergens, they can be food or pollen, get into the body and cause a chemical reaction that releases a chemical called histamine. And that reaction is fought with medications called antihistamines. And Zyrtec is one of many antihistamines that are available. They're safe and effective for long-term use. But if you're having to take antihistamines on a daily basis, you may want to consider some other therapies. For example, there are once-a-day medications that can prevent allergy reactions, or seeing an allergist for consideration of allergy shots may be another effective preventive therapy.
Interesting. You'd think taking Zyrtec would be better than taking shots, allergy shots, but...
Well, I mean, basically it's an antihistamine, or you know, acts just like one. And on a day in and day out basis, Shirley, you know, I agree with Dr. Larimore that there can be ramifications from that. You know, what happens is an allergen, and most people don't understand this, an allergen is merely an overreaction from an antibody in your system. And it's basically saying that this dust or this pollen or this mite or whatever is way more detrimental to my host, meaning the person that's living in, than it actually is. And so it goes into this kind of hyper steroid mode, if you will, and winds up, you know, producing symptoms like stuffy nose, puffy eyes. It produces more mucus than is necessary, hives, you know. And so the key would be to try and balance the immune system. And that would be, to me, the natural cure. And you can do that, most people, if they start eliminating processed foods and grains right away. I'll tell you something that's worked wonders for me for allergies, wonders, is exercise.
Really?
Every morning when I work out, Shirley, without getting into detail, let's just say I go through a lot of Kleenex. Now, if I did not move that stuff out of my body, I know I would just be full of it, and I'd really be struggling from allergies.
Interesting. That is very interesting. Well, let me give you a couple of other viewer questions. Since you are our expert today. Yeah, you're a supplement dude. How do I know if I'm overdosing on vitamins?
There's a few that are pretty obvious. Again, the body's almost always giving off signals. Vitamin C, bowel tolerance is your signal there. If you're taking lots of vitamin C, and if people are taking 2,000 or 3,000 milligrams of vitamin C, it makes all the sense in the world to take it in 3 equal doses and not all at once, you know. Some of your fat-soluble vitamins, like vitamin A.
Could we talk about that for just a minute? Because there's water-soluble and fat-soluble, and we want to be careful about overdosing on the fat-soluble. So what is the difference?
The fat-soluble vitamins are like vitamin E, vitamin A, vitamin D. And the nature of these fat-soluble vitamins is that they are processed through the liver, and so they can tend to hang up in the liver. For instance, fat-soluble vitamin A, and I actually did slightly overdose on this. Yeah, so it was beta-carotene, and beta-carotene is known as the precursor to vitamin A. It's known as the organic form and only converts to vitamin A if the body's calling for it to do so.
Really?
Well, apparently my body was calling more than it needed. Maybe its eyes were bigger than its stomach, whatever. But
or you weren't listening or something.
Yeah, well, I wasn't listening. That's very likely as well. But if you're starting to overdose on vitamin A, you'll start to get a little yellowish or orangish tinge to your skin. Good news is that you stop and it'll go away fairly quickly. But a lot of times people can get awfully scared before they do that. Some other vitamins like vitamin K, if you start getting, if you're like bruising or your skin is very sensitive, or you pinch your skin and instead of going down, it kind of stays up, that's a sign that your blood is getting too thin. Again, vitamin K, to overdose on that, you'd be taking amounts that I'd have to ask you the question, why were you doing that?
Why were you doing it? Yeah.
You just go with what's on the bottle, and in most cases, you're going to be fine. And if you're going to be doing more than what's on the bottle, do it under the guise of a holistic-minded physician.
That's good. That's good. And then on the other hand, the water soluble, you don't have to worry about overdosing.
You're not going to overdose on it, but again, say with B complex vitamins, which are water soluble. Yeah, okay. that'll be your system telling you ixnay.
Good. Now, here's a good one. Vitamins make me belch. What can I do about that, or what does it mean? And that can be a problem for people. I know even when I went on the Total Living Drink, at first it made me kind of repeat a lot of, and it it wasn't pleasant, but it went away after a while. So why do vitamins have that distinct, distasteful,
Well, first of all, I like that word. I like that word "repeat" for belching. That's
do you like
cool.
that?
Yeah,
like onions. Oh, didn't
that's
you ever? Yeah,
that's so.
It's a good euphemism. It's like I can't eat onions. I repeat them.
Very proper. I'll have to remember that one. You learn something.
It's better than burp.
You learn something. In the case of supplement pills, if you're talking about pills and you're burping them up, or repeating them, and it's anything more than a few days that's happening, your system is not agreeing with them.
Really?
That is not for you.
And they can actually make you nauseous
yeah,
sometimes.
definitely.
I've had vitamins that actually made me nauseous.
I can't take B vitamins on an empty stomach. Now, I take them now, and I have been for the last several years. All my B vitamins I get from the Total Living Drink, so there's no reason to do that.
Yeah.
In a food supplement, like our Total Living Drink, that may very well be because you just dosed your body with such concentrated nutrition. It was like, oh my gosh, I haven't seen this much nutrition since I was born, and I was breastfeeding. So, in that case, give it some time, and usually
I did, and it did.
Yeah, and taper down, and then it stopped. Yeah,
Mm-hmm.
That's usually going to happen with something like
good.
that.
And of course, here's one that we've kind of, I'm going to skip that. This is the one I was going to read was, what do I do when my doctor says it's worthless? So we've already covered that, but here's the good one before we have to go to break. Is it okay to take all my vitamins at the same time?
Look, at the end of the day, if that is going to increase your compliance, and your longevity on taking the product, then yes. Is there some more specific advanced science to supplementing that says it's better to do that? Yes.
Yeah.
But at the end of the day, you got to do what you got to do to get it done. So
if a person could take certain vitamins at certain times quickly, what would they do?
In a perfect world, I would take water soluble in the morning, and I would take fat soluble in the evening with dinner.
Oh, good. Okay, that's great. Well,
Is that quick enough?
Yeah, that's quick enough. Good job. For more information, check out www.tln.com and then click on shows and go to Balanced Health. Or you can call 888-242-9393 for a copy of today's show at a very, very reasonable price. And coming up in our healthy cooking segment, craving Italian food? Well, look no further than the Balanced Health table. Stay with us.
Mangia, mangia.